Thank you so much for all the viewers of Unemployed Pinoy CEO. Please do not forget to subscribe, like, and comment on the Unemployed Pinoy CEO show. And also, the experience that I have is amazing. The set, the lighting, the host, the way he asks questions to me are very well guided and also very engaging. And I always want you guys to be on this show, and you guys are the next one.
Hello, everyone. Francis San Diego here, host of the Unemployed Pinoy CEO podcast. I would like to talk to you about my recent or my upcoming interview with Dr. Peter Morante. So this young guy or young friend of mine has a lot of achievements under his belt. So as you can see, or you will find out that what sort of profession or achievements he has, from being a caregiver all the way up to being a coach or nurse practitioner or nursing coach that they have. So I would like to invite you all guys to come check out and watch the upcoming episode with Dr. Peter Morante this coming September 3 at 6 p.m. That will be my third season of the Unemployed Pinoy CEO podcast. So again, guys, come check it out. This young fellow is just on his early 30s and he achieved a lot already. And he is not done yet. So he's going to do more things, and he has a lot of upcoming projects to come. All right, guys, and hope to see you soon, and have a great day. Hello, everyone, and welcome to the latest season and latest edition of Unemployed Pinoy CEO. I am your host, Francis San Diego. Today's episode, I would like to introduce to you a very good friend of mine who is a psychiatric nurse practitioner. Allow me to introduce to you Mr. or Dr. Peter Morante. Hi, Doc.
Hi, thank you so much, Sir Francis, and it's such a great opportunity to be in your show. And thank you for having me here. It's such a pleasure.
Yes, I mean, it's welcome back to you again here, huh?
Yes,
Yeah,
seems like yesterday.
Yes, I know, right? So, yeah, I mean, I'm so happy that we saw each other again, and through our common friend, which is Miss Wendy Lindo. Hi, Wendy.
Hi, Miss Wendy.
Yeah, so she introduced you, and Wendy's invited Doc Peter to be a guest on her show. So, again, would you please introduce yourself to our viewers out there? And by the way, this is the third season. You're my first ever guest for my third season. So I'm happy to have you here. Yeah, kindly introduce yourself.
All right. Thank you very much, Sir Francis, for having me again in this amazing Unemployed Pinoy CEO show. And it's a pleasure to be here. And hello sa lahat ng mga viewers natin, especially mga kababayan. I'm Dr. Pedro E. Morante, but they call me Peter. Probably some of you have seen me working in different setting of hospitals and also clinic. But currently, right now, I'm a psych mental health nurse practitioner. So I work in outpatient practice, but especially COVID, that we had these limitations to be in the clinic setting. So we usually do the telehealth or telepsych setting, wherein you see your patients in through telehealth platform, which
online,
you can reach
right?
Online,
Yeah.
which you can reach a lot of people through HIPAA, which means privacy secured system.
HIPAA compliance,
HIPAA
right?
compliance.
Yes. That's really good. Then, yeah, definitely. Like what he mentioned, it's really important to have a great mental health, right? And that's why Dr. Peter is here to somehow share some of his expertise when it comes to mental health. taking care of what to do and what not to do, something like that. So maybe let's go dig deeper on your what you do. So in this day and age, during COVID, right? We're still in the COVID, pandemic. So in your own experience as a psychiatric mental health nurse practitioner, right?
Yes.
Or what have you seen since it started, the pandemic, which is COVID, and how it like really affected each and every person?
Yes, it poses a lot of strain, especially during the pre-pandemic, intra-pandemic, and post-pandemic. So, these three sections, tinitingnan natin yan. So, pre-pandemic is a lot of people are used to different routines. They do what they like, they can travel, they can see their family and friends. And then when it hits the COVID, that's puts a lot of stress not only to the caregivers, to the different people in different setting, and it poses a lot of stressors in their mental health. We're not making it a priority as before,
Mm-hmm.
and during COVID, it really hits a lot of people, especially the feeling of being isolated, working from home,
Correct.
dealing with work, life, and also kids also.
Yeah,
Or
everybody is like
everybody.
everybody came into like really all at the same time, right?
Yes, it
So
was like
everybody,
fast and
yeah, really
quick.
fast, overwhelming, and they don't know what to do because we're not used to it, right?
Correct. It's like chaos. When there's a chaos or change, it's just our response to adapt to the current system.
Mhm.
And then after pandemic, which we're in, the Delta variant is still sinking in. There's still like a lot of anxiety, fear of the unknown,
Mhm.
or depression,
Mhm.
and basically having phobias of
Mhm.
what's out there,
Mhm.
and the security of having their kids being sent to schools.
Schools,
There's a
yes.
lot of phobia about it, and
Mhm.
fears, anxiety, and
Mhm.
it's,
So yeah, I know
uh,
definitely. Everybody in this, I mean, everybody in the world has experienced it, right? It
yes,
really affected each and every one of us. I mean, for sure. Like for instance, what you're saying, uh, like personally, when I experience it, it's somehow scary. Definitely,
mhm,
it's unreal. You can't believe it at first that you can't go out, right?
that's true.
You're like you have an enemy that it's like an invisible enemy. That's what they say, if I'm correct,
Yeah.
right? Correct me if I'm wrong.
Mhm.
So it's really hard, so you don't know what you're dealing with. Then I think the vaccine took how many months before it was just launched, and it's just like I think one of the most like really stressful things is like you're at home and you're watching news and all you see is about problems.
Yes.
So maybe you can share about like let's say how it affected each and every people or individual, and how did maybe you can share about how did you initially first what did you do as a psychiatric nurse practitioner, or did you do any like meeting with health officials or something like that? Maybe you can share to us.
Yes. What we did before we started with the pandemic is just enforcing our patient to at least do there a lot of self-care, right? Self-care means non-pharmacological
Mm-hmm.
interventions that they can do at their own, which
Mm-hmm.
is very cost effective.
Mm-hmm.
Can do meditation, exercise, those things, positive thinking, touching base with your family and friends, and also connecting with other people. That's very important.
Mm-hmm.
And then staying on top of what you're doing and making sure that you have some time off to take care of yourself also.
Mm-hmm.
Just a lot of people are not paying attention to
Mm-hmm.
their mental health, that they
Correct.
think
Everything
everything
is
is
normal.
okay, and
Yeah.
then when it boils down that there's pandemic, then you will they will tell it seems like they're not okay because it's affecting their work, their relationship, and
Mm-hmm.
also their inner self.
Mm-hmm.
Like there's something off about them, and sometimes you don't notice it, but your families or your friends thinks that there's something going on, that you need a little bit of help
Mm-hmm.
with mental health professionals. And it's always important to have like a self-acceptance
Mm-hmm.
and being aware of yourself. Self-awareness is really important.
That's really interesting. I mean, yeah. So like, let's say when they, like, let's say for example, how do you know if a person has a, I don't know how you categorize it or what you call it, right? How do you categorize, like, let's say a person if they like in, is there such thing as like a stages of, like, having a poor mental health? How do you assess it? What's your process like when you assess somebody who's dealing with some mental illness or mental health problems? How do you assess? Do you assess it or something?
Sure. We follow the DSM 5 guidelines.
Uh-huh.
So that's the Diagnostic Statistical Manual of Mental Health Disorders.
Mm-hmm.
And basically, what we see in our patients that we do like typical questionnaires like PHQ-9 for depression
Mm-hmm.
and also GAD-7 for anxiety.
Mm-hmm.
And then we ask those criterias or how they're functioning in terms of their sleep, appetite,
Mm-hmm.
their ADLs, and
Mm-hmm.
also how are they functioning at work. Have they
Mm-hmm.
noticed anything unusual about their movement?
Mm-hmm.
Have they noticed any trouble with their focus or concentration? Or I always tell my patient, have you ever felt that your brain is playing tricks on you, that you tend to hear some voices, or you tend to think that you want to hurt yourself or other people, which are pretty much risk assessment. And
Mm-hmm.
how do they feel about this pandemic
Mm-hmm.
sense of social isolation?
Mm-hmm.
How are they coping?
Mm-hmm.
Do they have the support? And do they always, are they aware of what's going on to them and
Surroundings, right? So
surroundings?
how do they, like, let's say you mentioned earlier that self care, right?
Yeah.
Now I guess maybe the viewers out there who's watching this episode about mental health, how do they uh do the self care if they're at home where there's like a lot of tensions or stress going on? How do you
Yeah.
deal with that, or what's your suggestion? What do you suggest to them?
Sure. I tell my patients they have to put some boundaries, like a time for themselves. So if they have kids, like they wake up at 6 a.m., probably will be wise for the parents to at least make like an adjustment of their time instead of them waking up also at the time that the kids are up. I always tell my patient to be an early riser to at least set time for themselves. Just having the me time is really important for a
Yes.
lot of my patients, and then that me time will actually make an impact in how they progress and handle their stressors. But it's case to case basis. But I find it very beneficial that if a patient takes time to take care of themselves and they have their me time or self care time, it creates a different impact to them, and
Yes.
especially
Actually,
improves the mental health.
you know what?
Ah,
I believe that because I've done it actually. I mean, yeah, I this past few, yeah, because like I've took like 3 weeks off in doing the show, right? So what I did is like I tried to assess myself because definitely I'm affected with the stress, right, of what's going on with the pandemic. So what I did, well, like you mentioned, I adjusted my routine. I adjusted my time. Believe it or not, I'm waking up 3 o'clock in the morning.
wow.
Yes.
Yes.
Then because I guess maybe like it's like the mental thing that I kind of like rewired my thinking. Like I gotta make this happen. I gotta wake up early. I am very productive actually. I finished a lot. Like we were like talking earlier. I mentioned to you that I finished. I am about to launch my software, right?
Yes, congratulations.
And because I mean I'm about to do that, and because of that I adjusted my thing. Because if I wake up, like you mentioned, if you wake up the same time as your kids, it's gonna be like stressed. Your day is gonna be like, I've experienced that. And definitely my wife experienced it because we're in the same house, right? So when I did that, it's really remarkable that you mentioned that, how exactly the same thing that I did, became more I guess my mind is clearer. You tend to like think much faster, productive, and everything, and it helps me. So now you can during the rest of the day, although I do take naps like after lunch because I'm like really sleepy.
Sure.
3 o'clock in the morning, then you're up until 1 o'clock is like almost like 10 hours,
10
right?
hours.
So you tend to get tired. But again, that's the difference that happened to me. So yeah, maybe what are the tips that you can maybe like share with the viewers in terms of like, let's say, how to handle it? Like if you have some, I know that later on we'll tackle about your the Morante. Can you what's that again?
Morante formula.
Morante formula. We're gonna talk about it shortly.
Sure.
So maybe going to that one, maybe you can give us some tips in terms of like how to handle the mental, like how to handle the stress in what we are dealing with right now with the pandemic.
Correct. And especially if self awareness is very important, and also at the same time management is really important. Establishing a good sleep routine. M- Sleep is very important. It could actually make it or break it. Your day will not be functional, or seems like your mental health will be worse if you don't get enough sleep. So I always recommend my patient that establishing a good sleep hygiene is really important,
Mm-hmm.
and also at the same time practicing movement and meditation,
Mm-hmm.
time for yourself,
Mm-hmm.
a quiet time
Mm-hmm.
wherein your mind is not full. Yes. Just being mindful about your feelings
Mm-hmm.
and expressing those feelings and writing down probably in a form of journal. A lot
Yeah,
of my patients are really not open about their feelings, but when you ask them to write journals,
they're gonna
they
write it down.
can write it down how they feel. Are they upset? Are they sad? Are they
Mhm.
anxious about what is happening? Are
Uh-huh.
they could they have done better? And that's the time we're in. A lot of patients enjoy journaling because they are able to express
Express
themselves freely.
themselves. Okay.
And if emotions are expressed freely, and that improves mental health care outcomes too.
Yeah, nice, nice, nice. So now maybe yeah, after that one, thank you for sharing that one. So maybe now we can talk about the Morante formula.
All right.
Maybe you can share to our viewers what is the Morante formula.
Thank you so much, Sir
Yes.
Francis. So the Morante formula, sorry for being self-conceited. Probably it's from my last name.
No, you own
But
it.
thank you so much. But
Uh,
I practice this also to the students that I serve. So I'll start with the letter M. My letter M starts with make it a habit to always believe in yourself, and that there's a divine intervention that will support your goals. And it's always important for you to be the boss and know your goals and aspirations in life. And if you believe that you can do it, everything will be possible. And all windows and doors will open, especially when there's opportunities. You believe that you can do it and you can achieve it. My next letter is letter O. Letter O stands for organization, okay, and time management. If you know how to value your time and you know what to prioritize in life and what are the things that are important to you and what are your passion, you tend to develop a sense of self-drive in order for you to achieve those goals. My next letter is letter R from my last name, means removal of self doubt, anxiety, and proper management of stress. Stress will always be there, but if stress, anxiety, and self doubt will be removed from your system, you tend to be more positive about yourself. You tend to be more productive. You tend to achieve what you want to achieve, and you tend to be more optimal about your thinking in the sense that you can achieve your goals in life. Okay. The next letter is letter A. Anticipate where you want to go. If you know what your goals are and what you want to achieve, everything will fall into place. What is your goals 3 years from now, 5 years from now, 10 years from now, or 20 years from now? Anticipation of what you want to achieve creates you like a purpose in your or a fire that will ignite in your vision or in yourself that you want to go for it and achieve it. Right? The next letter is letter N.
Konti na lang.
Malapit na.
Alam.
Letter N is never doubt the power of positive thinking. And I always tell this to a lot of my students that I serve and my patients that I serve. Positive thinking can go a long way. What you're thinking, if you're thinking positive thoughts, positive things will happen. If you're thinking negative things, then negative things will happen. Okay? And then the letter T is trust your instinct and trust that there will always be an opportunity for change, and failure is not a hindrance to your goal. And failure will teach you a lot of lessons in success. And a lot of successful people will always tell you that they had a lot of previous or bad experience in the past, and that shaped them and that strengthened them into being where they at right now. So Rome is not built in one day. The same thing. A lot of bad experience could happen in your life, but it will teach you lessons, and those lessons will be applied to your current life to better off your position in life. And then the next letter is letter E, and I think we all need to do this, especially during COVID. Exercise. Exercise will bring you a lot of natural chemicals in your brain to improve those dopamine, norepinephrine, serotonin, which can make you feel good about yourself and being consistent with your routine. And the more that you exercise, the more that you develop this consistency, and the more that you feel good about yourself. And that's all we want to spread about a lot of people. It's all about good health, good mental health, and also positivism.
Nice. Very well explained. Well, buti na lang hindi ako nag-come up with my own meaning of my last name. Mahaba 'yun. Baka maging nobela. So anyway, yeah, I would like to thank you for sharing that your Morante formula. Definitely a lot of people will benefit through that one, and it should be like on the t-shirt, right?
Yes.
Yeah, of course.
And
Definitely.
salamat, Sir Francis.
Yes. So yeah. Anyway, so now moving forward, now I know that maybe we can discuss about your own training center, the Morante and Associates Training Center, right?
Yes,
Correct.
thank you.
So yeah, let's talk about that, because part of which you're a nurse practitioner, psychiatric mental health nurse practitioner. You're also an entrepreneur, but on a medical field, right? Maybe let's talk about Morante and Associates Training Center. Would you please explain to us and tell us about it?
Sure. Thank you so much, Sir Francis, for having this opportunity to talk about the Morante and Associates Training Center. So it started as a dream. As an educator before, I always envisioned like, what if I could have my own avenue to influence people also and help people that are struggling with their test anxiety, with their self-doubt that they can make it on the exam. And I use this as a tool, the Morante and Associate Training Center, to open up like reviews for different avenue. Started as NCLEX RN and NCLEX PN for the LBN students, wherein we created like a boot camp for you to be able to succeed on the NCLEX test prep plan. And a lot of our kababayans also are very interested and very engaged on doing this class, because it makes them refresh from the contents that they have, and also application of their test taking strategies. So that's what I want to inculcate to my students, to work with them about their test taking strategies on how
Preparation, right?
yes, and how to prepare for the exam. Okay. And also a lot of my students that are family nurse practitioner. I'm also a family nurse practitioner, by the way, before I became a psych NP. So we also have a family nurse practitioner board certification exam, both for AANP and ANCC. And at the same time, my first love, which is mental health, the psychiatric mental health nurse practitioner track, and which a lot of students of mine love the program, talking about the 5 domains of the ANCC,
Mhm.
and they build up their confidence on to take the exam on their first try. But I
Mhm.
also work with students that are taking the previous exam which are not successful, and there's a lot of factor that we can talk about probably why they're not successful.
Mhm.
Probably poor test taking skills,
Mhm.
poor preparation, and also different factors. Especially it's COVID, there's a lot of like anxiety, test anxiety that is going on, especially when you're confined in the testing center. But actually, a lot of exams right now, they can you could do it at the comfort of your home,
Mhm.
but still you need like a mentor,
Mhm.
like somebody that could guide you on how to best approach your preparation exam,
Mhm.
because whatever you might see in practice may be different from uh, the actual
Actual, yeah,
exam. So
yeah.
sometimes there's like a disconnect. So we want to connect them together in
Mhm.
order to reframe your mindset that this is how you approach things and how to deal with ideal setting.
Mhm.
So that's we're working on, and I'm proud to say that we're very successful with producing different psych mental health nurse practitioner board certified by the ANCC from different states. I teach
Nice.
from 50 states. So I have different students from each states of the United States, from
Nice.
different race, different
Congrats.
color, and it's an amazing feeling. I didn't expect it to be like that. That COVID will open up an avenue for me to basically teach online,
And you're
and
helping.
yes,
Definitely.
and at
That's
the
the first
same
and
time,
foremost.
that's the passion. Money comes secondary, but the passion to educate more clinicians at
Mhm.
tulungan mo sila to apply those evidence-based practice
Mhm.
and to boost their confidence, and
Encouragement,
also
right? Mhm.
encouragement that they can do it, because we need more psychiatric mental health practitioners and
Especially
clinicians,
now, right?
especially now. So we
Mm.
want to create an impact, and I hope in my simple way that we could change and improve the mental health access in different states, because it's not only California that is struggling,
Mhm.
but different states they have like a lot of wait in order for them to see their mental health provider.
Oh,
So
okay, okay.
sometimes being on a waiting list, you're delaying the care, and if the care is
Correct.
not addressed, then the more that the
Creates more
patients
problems,
creates more
right?
problems. So
Creates
it's like a
more.
boomerang.
Uh-huh.
So we can make this world a better place by producing this top safe
Mhm.
clinicians,
Mhm.
both for family practice and also for mental health setting.
So
And
you mentioned about you have like pretty much every state that you have some certified, right?
yes, so I can attest that if they go to our company's website. And at the same time, the students became eventually a part of the family,
Mhm.
wherein they kind of like connect with me,
Mhm.
and then also they do their continuing education units.
Mhm.
They do their ACLS, BLS,
Through
CPR,
your training center,
yes,
right?
Pulse Training
It's really
Center.
good.
So it's like a big family, and we want to make sure that we keep the student as the top priority,
Mhm.
and they're satisfied about it, like a one-stop shop.
Mhm.
That's like being servicing what they need. And I'm still thinking like how can we best serve the clinicians and the people that strongly believe with the programs. And that's what I envision, not only to um, make them licensed or certified, but also make them the best clinician that you can have.
Wow, I
Okay.
mean, you're a busy person. Huh? Dami mong ginagawa. Well, I would like first and foremost, I would like to thank you for doing that. You're like an asset to the country and to our fellow Filipinos, right? So it's an inspiration, and I'm really thankful to have you here as a guest and sharing your expertise to our, to our viewers out there. Maybe you can share to them where can they follow you if they're interested in furthering their education, and at the same time getting some tips from you directly. Maybe you can share to the viewers out there your where they can follow you, your website, your social media, and the likes of that one.
Correct. Thank you, Sir Francis. Once again, I'm Doc Peter Morante, and nananawagan po ako sa ating mga kababayan. and connecting with different aspects. You guys can serve as an avenue for me to be your provider also. For those who are struggling with mental health issues and concerns, you guys can reach out to um, our website www.moranteandassociatestrainingcenter.net, and also my Facebook at peter.morante, LinkedIn at Pedro Morante, my YouTube channel wherein I talk
Yes.
about the 5 M's from Wendy Lindo show, and some content areas wherein we can talk about mental health disorders and how to improve your mental health outcomes. So that's DocPeds. And then at the same time, we cater to different clients. Okay, don't hesitate to reach us. I also have Instagram at Morante Associates Training, and then also you guys can sign up to the web page, and then also the information on how to contact us through the informations are embedded on the website. And I always support the kababayans, especially you guys are the ones that entrust and believes. So you always support, and thank you so much to all the followers of the Facebook group, the YouTube channel, and also the Instagram. You guys are the boss. Without you guys, wala ako. And without you guys support and undying support to this program, it will not be possible. So it's all you that made it possible, and it's God that created this avenue for me to be and as a simple avenue on how to create a positive impact to the community. And I'm just blessed to have the people that believe and supported me since day one, especially my parents, my mom and my dad, and my brother, my special someone, and also my friends, and also family, and my newfound friend, Sir Francis, Sir Bernard, and Miss Wendy
Oh
Lindo.
yeah, thank you, thank you. Yeah, I was about
Yes.
yeah. Thank you very much for that one. Then yeah, we're
Yeah.
fortunate enough to know you. We're really blessed to be surrounded with like-minded people, right? So maybe before we end, I would like to ask you, who is Peter Morante outside of the being a nurse practitioner?
Wow.
What
So
are you? Maybe you can share to us some lighter side of you. Do you like to travel, or maybe something to share to our viewers?
sure. So Peter Morante outside his workplace
Uh,
is a simple guy with a vision and mission to enjoy life.
mhm.
And also, I'm a very funny individual, or I have a lot of sense of humor. That's what my friends will always tell me. And I I'm a simple guy which puts his creator as number one, and the family. I'm very family oriented.
Yes.
I have a close knit of friends,
Mhm,
but I also have like different networks which I connect with.
mhm,
But I love to travel and also experience life.
mhm.
And COVID had taught me that life is short. You
Correct.
have to live with the moment.
Mhm,
Do not dwell on the past,
mhm,
and know where you want to go,
mhm,
and you know where you want to achieve, and always be thankful
mhm,
for every day is a blessing.
mhm,
And every day that you are alive here, make the most out of it,
mhm.
because nothing is promised.
You're like a young man with an old soul. He is. He is really matured. He knows what he's really smart. Yeah, I mean, with the title, I mean, hindi na magkasya yung, pag sa application form, hindi na kasya yung title.
Yeah.
But it's really good. So, I mean, yeah, I mean, I would like to thank you for being here from Santa Clarita Payat. And also, I would like to thank you to your special someone who's with you
Yes.
today. So I don't know if you want to do some shout out before we end the show.
Sure. Thank you so much for all the um my family, F, my friends,
Mhm.
and my letter F, followers. All those three Fs are the ones that make it possible for me
Uh-huh.
to be where I am at right now. Maraming salamat po sa lahat ng sumusuporta sa Morante and Associates Training Center, sa lahat ng pasyente na natulungan ko, at sa lahat ng matutulungan ko pa, sa mga estudyante na nag-struggle with their task-taking anxiety. I'm always here for you. And please connect with me. Do not hesitate. It's always important to connect with people that could best guide you to where you want to go. And I'm just very blessed to have this avenue to connect with people and to create an impact. And that's my goal. 5 to 10, 20 years from now or 20 years from now, it's all about creating an impact. And money is secondary. Money comes if you like what you're doing. And I have this burning passion to help you guys out there. And I'm here for you. Andito lang po ako. Just make a simple communication and we will reach out to you.
All right, folks. Thank you again, Doc Peter, and it's an honor, it's a pleasure to be to have you here. And all right, guys. Again, I would like to thank you all for our followers. Again, this is our third season of Unemployed Pinoy CEO. This is Francis San Diego, and I would like to thank you all. See you again next time, guys.